Well, hello everyone, and welcome to today's Weber Training teleclass, Human Factors and Collaboration, a special lecture for Clean Hospitals Day that takes place on October 20th each year. Now, we have broadcast this lecture on October 20th since 2020, I think. But this year it was decided to broadcast a bit early so that the audience members can make use of the materials for their own activities on Clean Hospitals Day. Now, my name is Paul Weber, and it is my honor to be able to introduce two speakers today. Dr. Alexandra Peters is based at the Institute for Global Health. That's at the University of Geneva, and she's president of the Clean Hospitals Group. I'm going to let Alexandra tell you more about the Clean Hospitals Initiative, but let me just say that Weber Training has been a proud supporter of it from the very start. Alexandra's background is in infection prevention and control and health security, and she is, when you get to know her, you can find this out, she is absolutely passionate about infection prevention, planetary health, which is fascinating, human behavior and teaching. Also joining us today is Martina Mocenic, and forgive me, Martina, for messing up your name. Martina is Educational Program Lead for Clean Hospitals Group. She is an experienced nurse. She's a leader. She's an educator, infection control expert with over 20 years in healthcare. Now, she began that career in intensive care and anesthesiology at Pula General Hospital, where she continues. She served as head nurse of the ICU. For the last decade, she has specialized in hospital infection control and is a key member of the Infection Prevention and Control Committee. Her team was recognized with the European Award for Excellence in Hand Hygiene in 2021. Martina holds degrees in nursing management, and is currently a PhD student at the Malmö University in Sweden. As president of the Society for Prevention and Control of Infection Preventions, Society of Prevention and Control of Hospital Infections within the Croatian Nurses Association. She plays a leading role in advancing the profession nationally. It is really a great pleasure for me and an honor to invite Dr. Peters to begin this year's Clean Hospitals teleclass, Human Factors and Collaboration. Alexandra, the floor is yours.
Hi, Paul. Thank you so much for inviting us. And it is indeed an honor to be here and to be able to celebrate Clean Hospitals Day again this year with you. So just to go over the agenda for today a little bit, we're first going to look into a little bit more about what human factors and collaboration actually mean in healthcare environmental hygiene. Then we're going to introduce you to Clean Hospitals Day, go into our 2025 Clean Hospitals Day partners, our social media materials that are available for free for everybody to use, where you don't have to be a member of Clean Hospitals to access them, and we really encourage you to use them. A summary of the outreach of last year's Clean Hospitals Day that we hope to have even more outreach this year. And then Martina will go into how her hospital celebrated in Croatia, and then ways to participate and to share our message. So just as a little bit of a recap, healthcare environmental hygiene is made up of two types of factors. So the first one is the technical components, and that was actually the subject of Clean Hospitals Day last year. So we're looking at surface cleaning and disinfection, water control, air control, laundry, sterilization and device reprocessing, and waste management. But that's only part of the story of what environmental hygiene is. The rest are the human factors, and that's what we're going to be focusing on. And this list is not exhaustive, but anything that has to do with the people that are working in environmental hygiene goes under human factors. So that's anything from training, monitoring, management, workflow, the cost and value of investing in environmental hygiene, how the workforce is composed and how it behaves, and career development. And what is important for us to really keep in mind at the heart of all this, our goal is to break the chain of transmission. That's why we do infection prevention. That's why we do environmental hygiene. And that chain of transmission is shared between the host, the environment, and the pathogen. And so, although it seems really basic, one of the most important question is who cleans what? Because everyone is really crucial to the outcome. So, in a hospital or in a healthcare facility, you have environmental services staff, nurses, and nursing assistants that are all responsible for cleaning certain items, but sometimes it's not very clear who cleans what. And what's really important is that the tasks are clearly divided between the cleaning staff and the nursing staff, and that no areas should be left unassigned or uncleaned. Because if an area is left unassigned, I can guarantee you that it won't be cleaned. And then we're always talking about wanting to have a good quality of environmental hygiene program. And oftentimes hospitals spend a lot of money on the newest technology, on all kinds of really strong products that have a really good safety profile or really good efficacy. But at the end of the day, if your workforce isn't of high quality, nothing can be of high quality. So it's important to remember that if your workforce isn't motivated or appreciated, you won't have high quality work. Environmental hygiene work can be stressful, it can be high pressure, it can be physically demanding. And hospitals need to be sensitive to the concerns of workers. And the team cohesion and empowerment of the individual is crucial. And I'm sure we've all had experience being in a job that we didn't feel like was a career. And very often that's an issue in environmental hygiene, especially because it's one of the most underfunded, undereducated, underpaid groups of workers in a healthcare setting. So there's a lot of issues in environmental services departments. Very often there's inadequate or completely lacking training and education. It's not mandatory everywhere that environmental hygiene workers receive formal training. Traditionally, there's a very high turnover rate in most facilities, mainly because the work is difficult. It's usually paid badly. It can be hazardous depending on how it's done. There's often long hours. And people often end up with, I don't know why the slides are moving on their own. People often end up with lack of motivation. There's no certification that's available. And very often the environmental services staff are made up of immigrant populations, which leads to a language barrier between the nursing staff and the EVS staff. And that again, it shouldn't, it's very difficult to work together when there is that language barrier. So it's important that the populations of people that are working in EVS are educated enough to be able to communicate well with the nursing staff. And just to remember, you can only choose two. I think all healthcare facilities want something that's works really well and works fast and doesn't cost much. But it's important to remember that if you want something good that functions really well, it's going to end up costing more. And that environmental hygiene is something that is worth investing in. So when we talk about formulas for success, this is something from implementation science from the University of North Carolina, Chapel Hill. So they talk about effective innovations, effective implementations, and enabling context to bring about socially significant outcomes. So the innovations are the supplies we use. The implementation is the hygiene program itself. But what do we mean by enabling contexts? So enabling contexts have to do with optimizing human components or factors. And in order to understand those, we need to go back to the multimodal strategy. So the multimodal strategy is, or multimodal improvement strategy, is a behavior change model that's been extensively used in IPC around the world. So it was developed in Geneva for hand hygiene promotion and has been in use since 2009. It's been the basis of 3 WHO global surveys in hand hygiene with thousands of hospitals involved. There's other behavior change strategies out there, but this is one that's simple and it's effective and it's been proven to work really well in infection prevention. So that's also the behavior change strategy that we decided to adopt when working in healthcare environmental hygiene. And so it's made up of system change, which is the access to necessary products and supplies, training and education, monitoring and feedback, workplace reminders, and institutional safety climate. But what are we really assessing? So when you break those apart and you look at what those 5 pillars of the multimodal strategy are actually talking about, 4 of them have to do with human factors. And if we go back to what those human factors are, and we start thinking about what they all signify, these are all have to do with relationships. And they can be relationships between the EVS staff themselves, between the EVS staff and the nursing staff, the EVS staff and their management, EVS management and the hospital administration and the EVS departments, EVS and IPC departments, hospitals, training institutions, regional, national, governing bodies. You get the idea. Most of implementation and most of quality really has to do with human factors. And these relationships can be strengthened or they can be broken by the techniques that are used for training and monitoring. And if an institution wants to foster commitment and buy-in, that's complex. From our experience, punitive practices tend to work less well and sometimes only worsen the condition for an already marginalized and disadvantaged group of workers. And good training and monitoring and a good institutional safety climate will make adequate performance a reflex, that it's not something that has to be strived for all the time, that it can just happen. So EVS staff availability. Very often in healthcare facilities, there's only the minimum amount of staff that are working at any particular time, and they're on a schedule that I would describe as a best case scenario. So there's very often no extra staff for when there's a mess in a room or something's more difficult to clean or there's an emergency situation. And so what's very important from an institutional point of view is that enough cleaning staff is available at all times so they can respond to emergency situations such as spills, disease outbreaks, etc., without disrupting their regular activities. And we've seen sort of on a much larger scale what's been happening during COVID, when everybody was putting all of their resources into working on COVID. Everything else in the hospitals seemed to sort of fall apart to a certain degree, even though it shouldn't have. And that's why we have more HAIs, at least in Europe now, than we did before COVID. So optimizing environmental hygiene is as much about the products as it is about the institutions and the people. I would say it's even more about the institutions and the people. And all these elements need to work together harmoniously for improvement. Now I'll just share a couple examples of how the University Hospitals of Geneva organize their education and training programs for their environmental services workers. So there's an initial program upon hiring, and then there's a program for specific environments. And I'll preface that I'm absolutely aware that the University Hospitals of Geneva have a lot of funding to be able to basically do whatever they want in environmental hygiene and pay a really good wage. And um, they don't really need to worry about the budget in the same way that a lot of other institutions do. But I'm also convinced that with a much smaller amount of resources, it's still very possible to have a very solid environmental hygiene program. So the program starts off with what they call a reverse pedagogy approach, and it's an active and participative teaching method that involves role playing and feedback. So what they do for the first 3 days after someone is hired, they are paired with an experienced collaborator, an experienced EVS worker, and they follow them around in the field or in the hospital for 3 days. And that way, and then only do they start their initial training and education program. And what that actually does is it gives them frames of reference when they're learning things. They've already been exposed to it. They've already seen something. It makes more sense. And what the hospital has found is that it makes the initial training and education program a lot more effective than if everything remains sort of quite abstract. And the objectives of the initial training and education program are to master the basic maintenance cleaning skills according to the different types of rooms and environments, and to master the organization and implementation of these cleaning operations with respect to the recommendations and institutional guidelines for hygiene, safety at work, health, and environmental protection. Once the new hire has acquired their skills, they're then validated. And so first they work in pairs again with an experienced collaborator. Then they work autonomously, and then their techniques are validated by a manager. So they don't only look at whether there's dust on a surface, they look at how that surface was cleaned, how the cart was prepared, how the solutions were diluted, things like that. Once someone's completed the initial program and they've worked for a specific amount of time in the hospital and everything's going well, then there's additional training for EVS workers that are assigned to specific environments. So whether that's the operating room, isolation rooms, MRIs, clean rooms, etc. And they use active and participative teaching methods, again, reverse pedagogy, role playing, and feedback in the program for specific environments. And it's also seen culturally, it's seen as something prestigious when an EVS worker gets to the level where they're allowed to clean an operating room, where they're given that responsibility. It's not correlated with an increase in pay in that institution, but it is really seen as prestigious and people are proud of it and they take it seriously. So how managers inspect the environment. There's 5 main ways that we inspect the healthcare environment when doing audits and things like that. So you can have the visual inspection of surfaces, direct observation of cleaning. Again, that's looking at how something is cleaned and what movements the person is doing with their cloth or with their equipment. Microbial sampling of a surface to see what grows once it's sampled. Fluorescent markers that can be put on a surface before someone comes into the room, and then you can go around afterwards with a black light and see if that marker has been cleaned off or not. And then there's ATP meters that measure the environmental residue, the bioburden on a surface. And so when you're deciding which to choose, obviously price is a factor because direct observation doesn't cost any more than the salaries you're paying anyway. And ATP or microbiological sampling can quickly get quite expensive. But beyond the price, what we really want to know is, do we want to measure cleaning, disinfection, or behavior? And depending on your environmental hygiene program, depending what is going on, depending what the challenges are in your institution, all of those methods can absolutely make sense. And it just depends on what you need, which method you test or you pick, sorry. So visual inspection is testing behavior, or did somebody wipe the surface? Fluorescent gel is testing behavior. Did somebody wipe well enough to remove the gel? Just a note that it can also affect environmental hygiene personnel behavior and perception. And I think in a large extent, that's a very cultural thing. There's cultures I've heard, for example, that in the US, they often use the fluorescent gel, and the workforce is very used to being policed in that way or assessed in that way. And there's never any issues with it. I'm quite sure that if you tried to use fluorescent gel to sort of catch people not cleaning things in the hospital in Geneva, the EVS staff, which happens to be unionized, would not be a big fan of that. So it really does depend on cultural perceptions and cultural norms. ATP measures cleaning. Is that surface, did you clean the biological residue off the surface? And microbiological sampling can actually test disinfection. Are there living organisms on the surface or not? So another issue that often comes up is certification. Why would we certify the people who clean? And there's a lot of good reasons to, actually. So certification increases staff performance. It increases the quality of the workforce. It increases consistency in behavior and in work quality. It gives you the ability to gauge the quality of the staff as a whole, the ability to assess structural weaknesses in your program, and possibly most importantly, it professionalizes the field of environmental hygiene. And I'll get to a little bit more about what I mean by that in the coming slides. So it's important to keep in mind, in many healthcare facilities around the world, EVS workers are the only healthcare workers that are not required by hospitals to have certifications or even training in some cases. And they are healthcare workers. So how can we expect to have quality in a field if we don't have professionalization, if we're using the same rules as what's being done in restaurants and hotels and just giving them a healthcare grade disinfectant to do it with? There's no way that you can have good quality. And when we look at the organograms of many healthcare facilities, the EVS department often isn't even on there. So if there's no support from the institution, all other efforts will be completely insufficient. And sometimes it's missing from the organogram because EVS work is outsourced, but still, it's still really important to realize what the role of these healthcare workers are. And often, if they are included in the organogram, there's no professional title. They're called housekeeping or cleaners or another name that just denotes that they're there to make the floors shiny and to keep patients happy and to make things look pretty, not that they're the first line against transmission of infectious disease. So What are the most important factors in institutional safety climate? And again, there's others, but this is just sort of my personal view on it. So I would say team cohesion, cooperation, accountability, and positive work environment are all extremely important. People need to be recognized and they need to be paid for their work and understand how important it is for patient safety. Every single study that I'm aware of that has looked at the return on investment of infection prevention has shown that there is a huge return on investment in infection prevention. The same is true for environmental hygiene specifically. Even though it's sometimes difficult to explain to institutions that investing in infection prevention, specifically environmental hygiene, is necessary, the data is there that it works, that it's important, and that it does give them a return on investment. Career advancement and upward communication within the team are also really important, that people don't feel stuck and suffocated in their roles. And it really comes down to investing in the workforce and respecting them. And it's clear that these are not always people that are educated to a very high reading level, but that doesn't mean that they're unable to do their jobs really well and really professionally, and that they shouldn't be given the opportunity to do so. So how do you sustain quality in environmental hygiene? It is important to invest sufficient resources in infrastructure and supplies, invest in sufficient resources in personnel, that the staff are educated to understand how important their job actually is. I can't tell you how many times I've seen someone cleaning in healthcare that nobody ever explained the chain of transmission to, or nobody explained Sinner's circle and how cleaning even works. And they just go through the motions of what their checklist says, and they don't even realize themselves how crucial their jobs are. The collaborator needs to be capable of quality and needs to have the understanding and the education in order to do so. Safe working conditions need to be prioritized, and that goes both for ergonomics and the chemicals that are being used. In my visits around the world to different hospitals, I've seen people work with very harsh chemicals, no types of masks or breathing protection, working 12-hour days with non-ergonomic equipment, and it after 20 years, it really takes a toll on your body. So it's important to keep that in mind, that hospitals need to invest in keeping their workforce safe, and then give them access to adapted training materials so people learn differently. And as I said before, EVS personnel may not have excelled in academic settings, which means that there needs to be a highlight on visual tools and practical application and learning by doing. And that's been one of the frustrating things when speaking to hospitals. Very often they say, can't you just do an online training and then we'll just train everyone online? And even if you intellectually understand how you're supposed to wipe out a sink, from having done in-person train the trainer sessions with IPC doctors and nurses that are extremely educated, we all did it wrong the first time. Even once we knew how to do it right, it's just there's this disconnect between understanding something and your body being able to do it. And I think it's really important in settings where what you're doing has coordination in there, hand-eye working together, and it's just really important that everybody is able to learn by doing. And so potential tools for this include reverse pedagogy, virtual reality, group sessions with role play, etc. Not saying that learning on a blackboard isn't useful, that learning online isn't useful. All of those can be useful, but at the end of the day, somebody needs to practice with their body what they're supposed to be doing. It's the same as a surgeon. You wouldn't have a surgeon read a manual on surgery and then do his first surgery on a live person. Workplace culture needs to be prioritized, and EVS teams need to be integrated into the healthcare system. So key points are that close collaboration of the Environmental Services Department and Infection Prevention and Control Department is crucial. And it's also important to adapt to adopt. So hospitals should implement improvements in their own way and in their own cultural contexts. And just a phrase that I really like. So a chief financial officer once asked a CEO, "What happens if we invest in developing our people and then they leave us?" And the CEO replied, "What happens if we don't and they stay?" So now to move on to the clean hospitals part of the presentation. So just as a very quick reminder, what is clean hospitals? We're a coalition of international stakeholders who work explicitly to promote and support healthcare environmental hygiene, and now also hand hygiene, through research, publications, participation in conferences and events, education and training, and specialized working groups. Clean Hospitals Day is every year on the 20th of October. So we started in 2020, which was about COVID. 2021, we had a focus on EVS staff. 2022, we had the Clean Hospitals Day International Conference in Geneva. 2023, we launched the Healthcare Environmental Hygiene Self-Assessment Framework tool. Last year, we went into the 6 technical domains of environmental hygiene. And this year, as I said before, it's human factors and collaboration. So we're very proud to have partners for celebrating Clean Hospitals Day. First and foremost, thank you again to Paul and Weber Training for the opportunity and for the support. We also work with Infection Control Today magazine, which has a large readership in the US, and with APICS International Infection Prevention Week, which is starting on the 19th. And their theme this year is Stand Up for Infection Prevention. So we've done a bunch of, we've made a bunch of materials that healthcare facilities can use and adapt. So the main poster that we have is "We're only as strong as our weakest link. Let's support excellence in environmental hygiene." And I'll show you the other materials now. So we have behind every safe patient is a great team. There's actually an animation on the right, but I think that it doesn't work in this format. But there'll be, oops, what's happening? Hold on. But those animations will be available on our website very shortly, so you'll be able to access those as well as the posters. EVS workers are healthcare workers. I think that this message is crucial to share and to disseminate because very often they aren't seen as healthcare workers at all. Cooperation fights contamination. That we can only prevent HAIs if we work together. Communication is the key to quality. Honest and transparent communication saves lives. And this is the one from before. The heart of hygiene is human. That we need to remember that it's people at the heart of everything that we do in infection prevention. And that you need to train to sustain a safe environment. That without training, there's no way that we can have quality. So this year, I'm really excited to announce that we have multi-language materials that are available for download. They should be live on the website by tomorrow. The English and French are available now, and the other languages should be available by tomorrow evening. So the translations have just been finished and they just need to get put up on the website. But this will allow healthcare facilities from all over the world to download posters that are in the language of their facilities. So we're really happy to have these materials. It's the first time that we've been able to have a translation in different languages for Clean Hospitals Day. Other promotional materials that you can also find on the website and download, there's a fact sheet on environmental hygiene, key facts and figures, a video conferencing background, the social media photo frame for LinkedIn or Facebook or whatever, and then a poster maker that you can print out posters for your healthcare facilities with your own photos, etc. We also have a selfie board that you can download, print, sign, and take a picture of, and then post it on social media using the hashtags environmental hygiene, Clean Hospitals Day, and Clean Hospitals. Every year, we write an announcement that's published in a number of different academic journals. So far, we have 2 that have been published. So in Infection, Disease, and Health, and in Antimicrobial Resistance and Infection Control. And there's other publications in progress at the Journal of Hospital Infection and in Infection Prevention and Practice. And we'd also just like to give a big thank you to all of those journals, that it's usually quite rare that journals will publish the same article in different journals at the same time. But we're really lucky that all of these academic journals really support the work that we're doing and the message that we're trying to get out. So global engagement, this was for last year because of course we don't have the material yet, but there were from different companies to hospitals from all over the world with huge followings, to companies that aren't even part of Clean Hospitals, but that took this campaign and really made it their own. This is a colleague from the Ministry of Health in Oman that has been celebrating Clean Hospitals Day for the last 4 years. And it's wonderful to see our slides being used in their celebrations. The European, the UNITIPS that for patient safety that also shared and wrote an article about Clean Hospitals Day and celebrating it. Another hospital in Pakistan this time. So it's been really great seeing how from a very small campaign, I mean, the first year we had maybe, I think 2 posters, and the second year as well, how that's been really growing into a global movement, and we couldn't do it without all of you. So in 2024, we're excited to report that we reached 114 countries around the world on social media, had 11,000 website hits from almost 4,000 unique addresses, a number of new website users. I don't know much about social media, but about 2.5 million potential social media impressions, whatever that means. A 90% positive sentiment score, which from what I understand is how people feel about the information that they're receiving through the posts and through the ads. 85% of all traffic visited the related Clean Hospitals Day pages. Identified 45 participating countries on the website itself. Over 60,000 verified social media impressions, and it was the first time that Clean Hospitals had an uptick on Google Trends, which is Google's sort of way of saying of noting what people are researching and what people are talking about. And so it's the first time that there was enough activity that Google actually picked up on Clean Hospitals Day. These were the 45 supporting companies that did the most, or not just companies, but companies and organizations that most amplified the messages and promoted the most content from Clean Hospitals Day. And again, we see some of these are Clean Hospitals companies, but many are not. And many are organizations that, like the NHS or the CDC, that were just really happy that they're also amplifying this message. So there's different ways that you can use the materials. You can share photos or videos of your team's efforts on social media using the hashtag Clean Hospitals Day. Promote the campaign using materials from the promotional toolkit. Share the Clean Hospitals Day teleclass and webinar recording to learn about this year's theme. Collaborate with colleagues to improve environmental hygiene in your facilities. Display posters and banners in your facility to raise awareness among staff and patients. Share your story on the Clean Hospitals LinkedIn page or community. Rate your healthcare facilities' environmental hygiene by using the Healthcare Environmental Hygiene Self-Assessment Framework. This, if you want to take a screenshot of, otherwise it's easy to find on our website. These are the addresses for the resources that are available, the promotional toolkit, the multi-language posters, our calendar of upcoming events. Some of the events are only available for Clean Hospitals members, but some of the events are public, so you can always stay updated on what's going on. Clean Hospitals on LinkedIn, that's where we're most active. And then if you would like to rate how your environmental hygiene program is in your own institution, you can complete the HESAF survey and look at where the gaps are in your environmental hygiene program. And so without further ado, I'd like to hand over the mic to Martina that will talk about how she celebrated Clean Hospitals Day last year in the General Hospital Pula in Croatia, and hopefully inspire you with some new ideas about what you can do in your own healthcare facilities.
Thank you, Alexandra. Thank you, Paul, for this opportunity. I'm really honored, and it's really a pleasure to share with you how we celebrate the Clean Hospital Day in the General Hospital Pula last year. So Pula is in the Republic of Croatia. So on October 21st last year, we celebrate Clean Hospital Day, and it was supported by hospital director, top management of the hospital, and all important managers in all the field, like economic department, technical support, etc. So during celebration, we had 2 talks. So 2 lecture was held, the importance of environmental hygiene in healthcare and the importance and the role of cleaning staff in the healthcare system. It was really interesting because there was a lot of employees who attend our celebration day, and they gave support to our cleaning staff during the time that we celebrated. That means that all employees in cleaning service and environmental care in healthcare facility, hospital stakeholders, management, healthcare workers, and our partners who manufacture the products and technologies that are really essential for environmental hygiene in healthcare facility also support our celebration day. So it's really important that we celebrate this day for our patient, because patient safety is the most important in every healthcare facility. Last year, as Alexandra presented in her slides, was focused on the 6 technical components of environmental hygiene. So we also involved the technical support and the technical department, because they're really important during our activities in IPC in the control of the air and the water. So the main focus of the celebration was to highlight the role of all employees in maintaining healthcare environmental hygiene in our facility, but especially to those who are less visible but very important. So it was our service department, especially cleaning staff, the person who worked in the laundry department, and also technical department, water and air control, waste management, and central sterilization department is instrument reprocessing and sterilization. As you can see on this picture, so there was different employees when we see it. So there was EVS staff, management department, nurses, and also physicians, as in the first row, all top management of the hospital. For us was really important because this was the first time that we celebrate Clean Hospital Day in our hospital and in all Republic of Croatia. So seeing happy faces, red faces, crying eyes, and a lot of tears on the cheeks was a clear sign to us that we are doing the right thing. In the conversation with all of them, I think about the cleaning service, I felt a trembling voice, gratitude, and happiness for being appreciated. Because today, in our working age, it's a fortunate to have staff who speak the same language and who understand us and who have a great desire to learn and educate themselves. So the education of the cleaning staff will be and today is a priority in our hospital, and we will do all that we can that we invest in education. On this picture, you can see on the first one on the left is our financial manager, and on the third one, you can see in the first row all top manager, director, duty director, quality director, technical support director. So there was all the time during the lecture and the celebration with us. So thank you to Infection Control today. They was publish our experience last year, and we describe it, and it was really a great experience for all of us that we can share what we have done and how we celebrate this important day in our facility and promote it all over the world, that everybody maybe can see it and think about to join also in the celebration this year. On this picture, you can see all employees who was attending celebration. So this is the picture in front of our new hospital. And yes, we have, after the lecture, we have a great celebration together. So we have refreshment and we socialize all together. And our sponsor of the event ensure that every cleaning staff receive one present with some chocolate and the flowers, and they was really surprised with that, and they was so happy. But I think for us in infection prevention is crucial to be present in the workplaces and to get to know all cleaning staff well, including their names and abilities. This creates trusting relationship and two-way communication, which is, I think, most important for success at all levels, including also healthcare environmental hygiene. No matter how ideal the technical components are and no matter how modern technology is, if the human factor is not involved and included, we are not in a good way in infection prevention. So I invite you all to join us this year and to celebrate together Clean Hospital Day all over the world. Please take a picture and post it on the social media that we can also learn for your experience and to share it worldwide next year. So we have some idea how you can also celebrate Clean Hospital Day. So first is gratitude and recognition. So maybe you can organize a small ceremony to present certificates or appreciations or symbolic award to the cleaning staff. You can maybe create a wall of gratitude in the hospital where patients and all healthcare or employees can leave thank you notes to our cleaning staff. Then the second will be involving staff. You can invite medical staff to write short thank you notes or anecdotes that can be read aloud or display. You can maybe make a short video or slideshow featuring the cleaning team behind the scene, so you can show their often invisible but vital contribution. Usual when all the work starts for the medical staff. In the morning shift, cleaning staff has done the first and nobody see. So I think that this part of the day can be really important, and maybe you can have some video in this way and to show and to celebrate it and to show it to everybody during the celebration. So if you have the LCD all over the hospital, then you can have the video all the time. Maybe you can take some picture of cleaning staff with the name and surname, and you can also have it all the time that they are like the slideshow turning. The third will be symbolic gestures, so you can buy them some flowers or small gifts like chocolates, personalized mugs, t-shirts with a slogan. You can organize and share breakfast, or maybe you can share some cakes or cake celebration in honor of the clean hospital staff. And the fourth will be educational and motivational part. You can prepare a short talk and use poster campaign with with the messages that Alexandra show us on her slides. Educate patients and visitors on the importance of the hospital hygiene. And the fifth is the public visibility. So, as I told a few minutes before, so post on the social media and on the hospital website stories about the cleaning staff with the photos and their personal messages. I hope that every one of you will find the best way how they can celebrate it in healthcare facilities. And I hope and I wish that we will have a lot of posts on the social media and that we will reach to every country in the world. So healthcare environmental hygiene is, I think, a crucial element in patient safety or in the healthcare facilities. So thank you for your time and thank you to listening us today. Alexandra?
Martina, thank you very, very much. And Alexandra, and I like you had on your slide there that training equals recognition. That if you train the environmental services staff, it's essentially recognizing them as being worthy of training,
Mhm.
and all the behind the scenes staff really. But environmental services is often overlooked. I wanted to ask, here in Canada, where I live, contracting out of environmental services is a big thing, and it's a big thing. Very big companies involved in that. Does that change the strategy for education and training when the facility itself kind of loses some control over
So,
how it's done?
outsourcing is complex, right? A lot of countries do a lot of it. I think there's inherently nothing wrong with outsourcing, but you get what you pay for. So if
Mhm.
you're outsourcing in order to save a bunch of money, chances are that the work can't be that good, you know? There's ways to manage outsourcing in that you can still have an control over the quality. I mean, for example, in Geneva, they outsource cleaning of very low risk areas, so only risk level 1, which is basically entryways and offices. Those can be outsourced, and the outsourcing companies are actually obliged to use the products that are recommended by the hospital, and then the audits are also performed by hospital employees. So that's one way to still keep control over what you're outsourcing. I do know that a lot of healthcare facilities outsource absolutely everyone from risk level 1 all the way through to operating clean rooms, etc. It's more difficult to have the oversight that might be necessary to really be able to guarantee that something is done correctly, but it's not impossible. So although I do tend to encourage healthcare facilities to keep at least some of their staff in-house, I do believe that there's ways to outsource responsibly.
Martina, do you have any comment on that from your perspective in Croatia?
Yes, also I can share the experience that we have in our hospitals. So we have outsourced force just for the low level, and it's really important that you have the control on the cleaning. So we do internal audit, and we check the cleanliness as Alexandra present on the slide how you can do it. So we usually choose 2 methods to check it. I think that really when you outsource companies, that you need to have clear contracts. So you need to be careful, and you need to write all the components that are really important in the contract, and then maybe you can be sure that they will use your disinfectant, and that they will do all the procedure education, and that in one way you can be sure that they are doing the great job, that they clean all high touch surfaces, and that they follow the protocols of the hospital. For now, I think and I hope that we will have enough staff, that we will in the future have only our staff, because I think that is the most valuable staff that we can have, and we can then be sure that our clean healthcare facility is really on the high level in cleanliness.
Yeah, one hospital here in Canada, I spoke with the environmental services director, and they got permission to create what we call hockey cards. They're trading cards that are for hockey teams, Canada's hockey, and so they had the environmental services people, a picture of them on the front of the card, and some interesting information about them on the back, and how long they've been working and that sort of thing, and where they work. And so they became so much more recognized because people had these pack of cards, and they would just, while they're lying in bed, they would go through the cards and look at the faces and read all about them. And in some cases, they were even asking the environmental services people to sign the back of their cards, and they would take them home. It was a really cool idea.
That's so nice. Yeah, that's a super idea.
Yeah, and the recognition just skyrocketed.
Mm.
And I don't think you can celebrate too much. As long as you're celebrating the right things, I don't think you can celebrate too much. It's a grand thing. So I'm going to leave it there. Thank you both very much for doing that.
Thank you.
On this slide, there are some mistakes because it was late at night when I was doing this, and I put in a previous schedule. You see the special lecture for International Clean Hospitals Day is still on the 20th, and that obviously is a mistake. But there are some teleclasses coming up next week. Next week, I believe. Next week is our Australasian teleclass on can knowing something about the evolution of Clostridium difficile teach us. What can knowing something about C. diff teach us about IPAC? And then a discussion with John Otter of the UK and Curtis Donsky of the US on Are Healthcare Cleaning Guidelines Sufficient to Fight Antimicrobial Spread? That is going to be very, very interesting. And then there are several others through October and November, and there are some that didn't fit on the page for December. Thank you to our patron sponsors, as always, Diversey and Virox and Gamma. These organizations help make this program possible. So thanks to all of you and to all of them. And Alexandra and Martina, a special thank you to you. This was a lot of work for you, and it was just really well done. I thank you so much for your time.
Thank you so much, Paul.
Thank you, Paul.
You're most welcome. Thank you. For everyone else, we will talk to you again very soon.